despite the fact that there have been numerous reports and evidence about the realities around PTSD and policing, that knowledge and the responses from the government haven't yet flowed. As a result of that, IPCO and the Solicitor General decided to conduct a review that was specifically directed at documenting the particular experiences that Indigenous police services experience from a mental health perspective. The First Nations policing program was introduced with the intent of allowing First Nations communities to have a role in governing the policing in their community. Unfortunately, the model set up under the First Nations policing program doesn't meaningfully allow for that. Instead, it imposes a colonial and frankly racist system of limited funding and of limited powers for the police services. The program was never intended to actually allow full policing autonomy inside communities. The funding was allocated with the expectation that either the provincial or municipal or federal policing program in the area would actually be the primary police provider, with the Indigenous Police Service providing sort of a secondary and frontline community engagement style of policing. But that's not the reality of Indigenous policing and Indigenous community needs or expectations. Indeed, what the community needs and expectations are is for full autonomous policing services to be provided. In essence, everything that every other police service has. Indigenous police services do engage in community policing. They do make decisions about how to respond to calls based on their understanding of the community, of the individual, and of the nuances that have brought the individual to this particular place. They do all of this excellent policing frequently alone in the community without backup, or where backup is either hours away or in some circumstances a plane ride away. It is exhausting, grueling work. And it's conducted inside the context that Indigenous police officers, First Nations police across Canada, respond to almost 3 times the number of calls compared to their federal, provincial, or municipal counterparts. They also respond to an exponentially higher number of severe and violent crime and critical incident calls. As a result of the experiences that Indigenous police officers have, they suffer from extreme levels of hypervigilance, exhaustion, guilt, and post-traumatic stress disorder. In my report, I conclude that the primary issue affecting the mental health of members is this gross underfunding, which contributes to a lack of staffing, a lack of tools, and a lack of capacity to respond to mental health and to provide the wraparound support that is required for police experiencing trauma.